Spotlight on the Salem Memorial District Hospital. We have Mr. Jimmie Bell with us.
Hey, good
Hello,
morning.
Jimmie. How are you?
I'm great. How are you guys?
You looking good.
Well, I appreciate it.
Wow, you're really looking good. They're keeping you busy, I hear.
Well, we're pretty busy, you know.
Well, that's a good thing.
Oh, yeah.
About
Yeah.
that.
Been there
Well,
10 months now. Everything's going great.
Yeah, that's fantastic. I remember when you coming over and we had a nice little chat that first time you
Sure.
came in and visited, but that's the last time we actually had a chance to sit down and talk a little bit. So we're glad that you're able to come in and take
Thank
a little
you.
time out of your schedule, and I really do thank you for that, making time for us. I know it's difficult over there when you've got patients and they want to see you too, but I know I rank.
Oh, absolutely. Well, we'll reach out and touch some new people today.
There
How's
you
that
go.
sound?
Very good. Well, we're here to talk a little bit about men's health. Obviously, Father's Day is coming up. And a lot of times people think, oh, men's health, they don't have all the issues that women's do. That there's some differences there. Yeah, obviously, we know that. But there is a lot of things about men's health that we do need to keep aware of. Obviously, one is prostate issues, especially as you get older.
Absolutely. Yeah, and I guess the biggest thing about men is there's a lot of pride associated there, and some of them don't want to come to the doctor.
Oh, yeah. That's
So-
that's a big one.
Usually, a lot of times that first visit, guess who's with them? The wife.
Bringing them in, right?
Yeah, bring them on. Bring
Yeah,
them on.
bring 'em.
Absolutely. And I always know when the wife's along, they're in trouble.
Yeah.
She's going to tell on them.
Well, but the thing is, guys need to be more aware of different things. Guys sweat more. They lose a lot of electrolytes very quickly. And, we don't think about it. We're used to doing it. I'm sure you did. You cut grass. You worked outside all day. You come in. You've sweated all day long. And you come in. You have a little something to eat or something. And you feel tired. Go take the shower. Feel relaxed. Hey, I'm good. You probably aren't. You're probably still dehydrated, but you just think you're good. And it's like you said with that guy thing, like, I'm masculine, I'm a man, I don't need to do all that stuff. You need to drink water, you need to stay hydrated. And without doing that, Jimmie, there's detriments that can happen to your body that you can't see.
Absolutely. Yeah. And when I get a new patient in, I really believe this. I mean, I always refer back to it's almost like pregnancy. There's trimesters in life, and when you're under 40, unless you have a motor vehicle accident or a birth defect or something abnormal, that up to age 40s, it's pretty normal, And then after you get past 60, that third trimester, well, everything that you did, and that's when I pick up most of these men, is about, very late 30s or early 40s. But that time for men, women, and everybody is very crucial between 40 and 60, because the path that you lay during that time really accounts for what's going to happen later in life.
Really does. And you do need to take care of your body, and I think more people are aware of it. I don't think people practice it as much as they probably should, and I think we're all guilty of doing that. We're in a fast food society. We're in a disposable society, obviously. We all know that. But our bodies are not disposable. Everybody says, oh, you can go get a knee replacement, you can go get this done and stuff. Hey, God gave you this body. You should stay with this body as long as you possibly can without having to make some artificial limb your next choice.
Absolutely. Well, I was in the military for 22 years, did healthcare, and then I came back here in '05, and it amazes me at the advancements, and it makes me question, what are we going to see in the next 20 years?
Yeah.
Because in the last 20 years, especially a couple areas with heart disease and diabetes, I mean, we've just made incredible gains. And one thing that faces everybody these days, and I'm guilty of it. I'm certainly not the picture of health myself in some ways, but this obesity thing in the United States is terrible. And juvenile diabetes is on the grow, and a lot of that is just from inactivity. But one of the things that we've been seeing a lot of are these new medications that are once-a-week injectable for weight loss. Wegovy is a once-a-week injectable. And I think these meds are going to be real life changers, because I could tell you some stories that are just incredible. Like one guy that I've had about 18 months, he's went from 310 to 180.
Wow.
Now strict diet, and he religiously exercises 3 to 4 days a week. But with that, we've taken away all of his blood pressure meds, his diabetes meds. I mean, just think of the decreased risk he has of a joint replacement.
Absolutely. Let's talk a little bit about getting started with this, and because you really need to face the facts. As you mentioned, get up to about 35, 40, you're probably feeling pretty good. You feel pretty spry. Maybe you almost feel like you're Superman. Hey, I get up every morning, I can take on the world and do this stuff. But as we do age and things get older, things don't recover as well. We start to put on that little extra weight. Our metabolism slows down. And for guys, Jimmie, and you can speak for this either personally or as a physician, guys tend to continue to do just what they did before. And sometimes with that extra weight, puts a little bit extra pressure on the heart, puts extra pressure on the back, puts less pressure on the knees and things of that nature. That's where you really need to start paying attention to your health, don't you?
Oh, yeah. The most important thing I tell someone when they first come see me is I work for you. So the biggest thing that I push is prevention. So that first visit, we're going to go through everything head to toe that you've ever done in your life, your past history. We're going to get some comprehensive labs. And I hate to bring this up, but a lot of people are hesitant to do that due to cost. Well, I'm going to throw a big shout out to our health department because they, through grants and other areas, they've been able to make it affordable for people to go get this health and wellness panel. Mm-hmm. And so I send a lot of people over there, and I appreciate their help. But a good panel of blood work, and anybody that's had history of colon cancer in their family needs that colonoscopy or colon screening at age 40. And a lot of guys especially, they don't even want to talk about that. So thank God now for the Colo Guard. I call it the, excuse the expression, but poop in a box, And that's how I describe it, because they send a box to your house, you put a sample in and send it back. But it's 92% reliable for inflammatory areas in the colon, polyps. And then if we get one of those back that's positive, you're headed for a colonoscopy.
Right, you have to check.
And they don't usually, once we get one of those back, they're scared enough that they're willing to go do the colonoscopy.
And there's nothing wrong with it. I've had 2 of them in my life, and and I think the last time Dr. Voigt found a few little things that he said, I took care of some things. They weren't cancerous. We were sending them off, but they didn't appear to be anything major. And you talk to the surgeon, and you feel pretty good about that. He has seen enough to know which ones look like lesions, and that can be very, very dangerous to your health. But preventive maintenance of your body, like you're talking about, you're working for me. So if I come in and say, all right, Jimmie, I can't do what I used to do. I don't have the energy I used to. Well, first off, if your base part is 30 years old and now you're 70, you're probably not going to have the energy you did. But there is that regression in your health that you have to be aware of. You can't do everything you used to do when you're 25 and 30 years old. You got to slow down. But at the same time, that doesn't mean you got to still eat like you were 25 or 30, because your metabolism was going 110 miles an hour. You were very active. You were probably out doing a lot of different things all day long. And now you're a little bit more sedentary. You get home from work, you put the recliner back, sit back, watch a little TV, listen to radio, whatever it might be. Things have changed, haven't they?
I really wish. I wish that we put more emphasis on physical activity. I wish the employers had the ability. Mm-hmm. Some of them will tell them, well, if you join a membership to the gym, you get so much off your insurance or something, and that's great. But if you don't use that gym membership, what good is it? Yeah. And I wish we had the ability for everyone to go work out, because it makes a huge difference. And physical activity, drops blood pressure, drops blood sugars. It's incredible for what it can do. And I always tell the people as they get older, if we lose your legs, we're going to lose you.
Let's kind of center this conversation back onto that gentleman you were talking about with the weight loss. And let's talk about people say, okay, hey, I'm going to listen to what Jimmie Bell says. I'm going to go out and I'm going to start exercising today. Maybe, and I'm probably 100 pounds overweight. Maybe you should probably go see your physician first before you decide to make that 3-hour workout today, because you can do a lot of damage to your body, can't you?
You can. We have the Armory, and we have the other fitness area here in town. And if you had a good trainer to help get you started, that's very important, because they can focus on the areas that they see are deficits right away for you. Mm-hmm. But yes, you can overdo it, and you've got to build up. Whether the person's 40 or whether they're 65, they can't just go in there and think they're 25 again. So it's got to be built up. But just about everybody, if they'll be, consistent with it and go 3 or 4 days a week, whether it's over to the walking track or whatever, they're going to get to the point that they're in pretty good shape.
Getting started is the hardest.
That's the hard part. And I love this. The first 2 or 3 weeks when I was working in Raleigh, we would go a couple of nights a week to Planet Fitness. You couldn't get on a machine for about 3 weeks in January.
Right.
The New Year's resolution.
Oh yeah.
And then about the 1st of February, it all opened back up to the normals. But that's the thing, is getting the motivation and just making yourself do this.
But people don't want to feel the pain when you do start to do this. Your muscles are going to ache. You haven't used them in a long time. They're going to be sore. That's normal. Doesn't mean you want to go yank a hamstring or pull a quad, but you're going to feel a little soreness. You have to work through that soreness initially, right?
I guess I'm a little tough, 22 years in the Air Force, and anything you go to do, whether it's your job, exercising, or whatever, nothing's going to be easy. No. There's something going to have some pain attached to it. And, yeah, you have to work through that soreness. And I promise you, if they'll get past that first 2 or 3 weeks, it'll get easier.
Oh, yeah.
But that's what I love about these new medications we have out, is I will follow them up in 30 days. And when you see that they've lost 8 to 15 pounds that first month, there's automatic motivation. And I always ask them, do me a favor. Don't weigh in the next 30 days.
Right.
Let's find this out together when you come back in here. And I always try and use the term 10 pounds. I say, hey, you owe me 10 pounds. So when they come in, they don't know whether they lost that 10, and sometimes it's up to 18 or 20. I always call that the baby fat. But the bad part is, after about 3 months and you've lost that baby fat, then you got to start really exerting yourself, strict diet, more cardiac activity, in order if you want to lose that continued weight.
Right. And there's that happy medium that you need to get to and weight. As we hear people say, I'm overweight, I need to lose that 10 pounds. Okay, so what are you doing to lose the 10 pounds? Well, nothing. But I need to lose the 10 pounds. Or this week I'm going to eat nothing but vegetables. Well, okay, that's this week. What about next week? Well, I want to go back and eat all the breads and starches I can. Because that's what I love. I love my buttered bread, and I want all that. Hey, we all love to eat those type of foods. But at the same time, those are the ones, as you get older, put that extra weight on.
It's hard to change.
Yeah.
I mean, and jumping over to another subject, smoking.
Oh, yeah.
When I talk about these trimesters of life, if I can get that person and get them stopped the smoking, okay, say they started when they was 20. Well, if they stop at 40, they've still got a risk of lung cancer down the road. But if we screen them at age 60 and they haven't had any problems in the last 20 years and they've been free of tobacco, then every year their risk of lung cancer goes down.
Right.
But it's the same thing there. There's the addiction to nicotine. And then there's also the habit. I guarantee you that someone that drives from here to Raleigh every day and works, I'll guarantee you that there's triggers. This stop sign, I turn on 72, I light a cigarette. I drink my first cup of coffee, I light a cigarette. So you got to deal with that nicotine addiction, and you have to deal with that habit. And that's the same thing with food. I've been really stressing this when we've been pushing, and I've got, I couldn't tell you how many pounds we've lost in the last 6 months in that clinic. And I always tell them, here's your homework assignment, and I really, really want you to do this for me. When it comes noon, 6 p.m., what do? It's time to eat.
Time to eat.
I want you to ask yourself, am I hungry? And if the answer is no, then keep some grapes or some beef sticks or something, something light. Satisfy that craving or that what you think is a need, and go on about your business without eating that huge meal in the evening that you don't even want to start with. Because I'm telling you, these meds that we use now, they will absolutely help you take the weight off if you're doing your part.
Right, and eat slow. Jason Edwards and I have talked about this many times. I grew up, and I know a lot of households did this, Jimmie, back, I guess, in the day. I know my dad was very busy. He had his own business, so we ate at 5:30 every day. 5:30. He came upstairs. Routine. At 5:45, we were done eating, no matter what. You were done, and everything better be off the table.
Sure.
Okay, so you had 15 minutes to sit down, put the prayer in, grab your utensils, dig in, eat your food, clear the table. Everything was done. Okay, so that means you got about 7.5, 8 minutes to eat. So you're shoveling it in pretty fast. And my dad's favorite with moniker was, "He who eats the fastest eats the most." Well, that's true.
Exactly.
Unfortunately, that's probably not always the best thing to do, but it was kind of what we did. So we learned how to eat very fast. So when I was talking to Jason, he goes, eat slow. Take the fork, pick it up, put it down. Take a drink of water, pick the fork back up, take a bite, put the fork down, we'll get the water, take a sip. You don't have to drink half a gallon of water, just take a sip. To slow yourself down, because you're eating so fast, your stomach can't tell your brain you're full, so you just keep eating, and then all of a sudden you feel horrible. You're overstuffed, and then you feel like a slug at that point. You just want to sit there and lay there. That's not helping your system at all, is it?
No, it's not. It's funny. I sat here and some thoughts run through my head, so I'm gonna jump off here for a minute.
Sure.
And I'm gonna say, moms, we miss you. And what I mean by that is you just mentioned something that we've lost, and that's the kitchen table.
Yeah.
I mean, used to, mom didn't have to work that job. It wasn't a two-income household, so you ate better.
Mm-hmm.
I mean, she cooked good meals that were healthy for the most part, balanced meals. And now, oh my God, we're off at 5 o'clock. We got to run over here. Somebody's got a ball game. We got to, there's just so much going on with the kids these days that most of the time it's a pizza or it's a burger, and it's not always healthy, and that's just today's society.
Yeah. Burger and a big Coke or some sugary drink.
Yeah.
Yeah.
It's not mom's fault. That's the best she can do.
Yeah. Well, and it's not dad's fault either.
Exactly.
I mean, if you have children and you want to follow the kids. I know.
Sure.
Back years ago, though, I can honestly say my dad very rarely ever got a chance to see me play because he had his own business.
Sure.
Doesn't matter. My son's playing. Mom, you go watch them. Take the siblings along with you if they're not playing. But I've got my job to do, and that comes first because you had to put food on the table. The only way to do it was to work.
Yeah, exactly.
So things have changed. I would like to talk a little bit about prostate health, because as we get older, men's prostate does not act the same as it did when you're 25 years old, and you need to see the signs, don't you? You
do. We always start at age 40 with a PSA exam. That's the blood test. Mm-hmm. You always hear the jokes about go in, they're going to examine your prostate. Well, usually I feel pretty confident. A lot of times people say anymore the PSA is not reliable, but in most cases where we've diagnosed prostate cancer, there's been a change in that PSA level.
Yeah.
And of course, naturally, if they're having some type of other sign or symptom, we do get an evaluation. Usually I send them to urology,
sure, because
that's their specialty. But we start that at age 40, checking that PSA. And the other thing that kind of goes along with that is when you're talking along that lines, is testosterone levels.
Mm-hmm.
I have these guys come in and they're just like, I'm exhausted. Well, yeah, they may be packing around a few more pounds and they may be working a lot and everything, but you would be shocked. And even guys in their mid to upper 30s, when we check a testosterone level on those guys, it's low.
Mm-hmm.
So, we're more diligent now about watching that, getting them on some supplementation, and that helps also. But, yes, that prostate issue is a big deal. And we have urologists in place, Rolla, Springfield, that we send them to. And they've made a lot of advances, even with, like, robotic removal of prostates.
Sure.
So it's something you're not going to get away from.
No, and guys, you get stuck with it, and it does enlarge, and it's just normal.
Exactly, and BPH, benign prostatic hypertrophy, is not cancer, but that guy who's got that slow stream or hard to get it started, or
continual need, feels like
he's got to go to the bathroom. He needs to go get checked out, and there are meds which help that to help reduce that inflammation. I put people on saw palmetto supplementation to help with their prostate. Right. So good advances there.
So as guys get older, and I'm gonna, you kind of already touched on it a little bit, but maybe even a review. It's time to maybe even strategize your age and what you need to do to stay healthy. exercise, eat the right meals, maybe curb back on some of those sweets. I know a lot of guys that watch a ball game, first thing they do is grab a bag of chips. That's probably the worst thing you can do is grab a bag of chips, and then if the game ends at 9:30, 10 o'clock at night, you're going to bed, and you got all that nice grease and everything inside you and those carbohydrates. Great, So instead of doing that, like you said, grab a couple of grapes if you're hungry, but don't eat don't eat 500 grapes. 10,
sure,
15.
Yeah.
But moderation. And I think, Jimmie, what you were pointing out earlier, get off your backside. Get on your feet. Walk. Go walk the yard. Don't take a riding mower all the time. Go walk it. Get a push mower, walk it. I still push mow my yard. I push mow the tower. I weed eat everything. Why? And somebody said, why do you keep doing that? Why don't you hire somebody? I said, it's exercise for me. I enjoy doing it. I used to perspire very heavily. And once I would do that and get home and I'd take that shower and come out, man, you feel so refreshed. You got all those toxins out of your system. And you drink that water, you rehydrate, you feel like you go back out there and do it again. But your body's telling you, like, that's probably not a good idea because you're not 25 anymore.
There's someone sitting out there this morning and they're listening to this and they're thinking, man, I hurt so bad. My hips, my knees hurt. These guys can talk a good line, but, I don't feel like going out there and mowing that grass or walking that 5 laps around the track. Well, I'll tell you what was really, really strange. A couple of years ago when we were going on a regular basis to Planet Fitness, I hurt less. Once I started getting on a regular exercise program, and when you fight through that first deal, and if somebody's out there and they want to grab a paper and a pen, turmeric, which is the main ingredient in mustard, helps with joint pain. Glucosamine chondroitin. Magnesium oxide. Right. These are all things you can buy over the counter, which you will be surprised how much those can help.
And some collagen for some people too helps. And do take it religiously. I have arthritis in both knees. I have lower back issues, but you know what? I just like you're saying, if I don't get up and move, my knees hurt worse.
Sure.
If I sit too long, they hurt worse. I'd rather be walking. And when I'm walking, I've got no problem walking. It's when I stop, and then you have to get back up and stuff. And I understand sometimes there's surgeries, sometimes there's injuries, and that's a little bit different.
Absolutely.
But mine came from playing ice hockey for years. And I knew it. I knew at the time when I was doing it, this was probably going to take a toll on me a little bit later on. But just as you're saying it, and I had this conversation with Dr. Al before, he goes, keep moving, just keep moving. When it gets to a point that you feel you need an MRI, we'll come in and take a look at it and see exactly what you have, exactly what we need to do. And he goes, but as long as you're able to get up and keep moving.
Exactly.
There's no need to even consider knee replacement. If you can get up and continue to go and you can walk without pain after 3 steps, keep going. Because if you keep walking, keep exercising, pretty soon it'll be 2 steps, then 1 step. And then pretty soon it'll just be a little bit achy when you get up. You got to put the effort forward, don't you?
Exactly. And when you talk about that, let's talk about heart. Mm-hmm. If you don't exercise, stay active, condition the heart muscle, because it is a muscle.
It's a muscle.
You're gonna find problems. And when you talked about that bag of chips and that stuff, I'm really rough on cholesterol. When they come in, we push those. Your total cholesterol, say someone who has diabetes or has a blood pressure issue, we want your total around 160 or less. Your LDL is your bad cholesterol. We'd like for it to be 70 or less. But anybody who has some significant peripheral vascular disease or congestive heart failure, we're pushing those LDLs down as low as 30 or 40 now. So that baby aspirin every day, if you're not allergic to the baby aspirin, huge benefit to that for heart protection every day.
That's right.
And so that's another benefit to coming and seeing one of us, is if we do a good physical on you, and people are hesitant to take pills.
Right.
And I understand that. But whatever we have to do to keep these levels, keep you on that baby aspirin for heart protection, prevention, we need to do so that later in life the road's a lot easier.
Well, let's back up, too. Just what you were saying with this one gentleman that you're working with him in that weight loss. okay, I'm on blood pressure medication, and I know that I don't exercise as much as I used to. I used to deliver a year old a day, and so every morning I was out running for 45 minutes, basically from stop to stop to stop to stop to stop. Okay, then I'd go home and I'd do my 20-minute workout every morning before I come in and go on the air. That was a routine for 20-something years. Didn't change. When you do that, you fall into that rhythm, like you're talking about. Your body goes into a rhythm. And everything, all those signs, every time I used to go to the health fairs, every one of them, I kept every one of those papers, and I'd see right where I stood. Every now and then, triglycerides would be a little bit high, or this would be a bit low, but nothing way out there, out in left field.
Sure.
And so I could keep an eye on it. Well, we don't have the health fairs like we used to, but we do have low-cost tests that you can get this done and still keep an eye on it. But you still need to have the watchful eye of a physician to take a look at these and say, okay, look, these are good, these not so good. We can improve this without, okay, maybe we do need to take a little medication at first. Go exercise, do this, check your diet, do this. Let's come back in 2-3 months and let's see if we can get you off of that stuff.
Sure. Sure.
Because if you can take that one gentleman off blood pressure medication and take him off maybe pills for his knees and everything else, anybody can do the same thing.
Well, it's not a great story, but it's a story.
Okay.
I had a patient the other day that I got notified the next morning that he had driven himself at 2 o'clock in the morning. Now, there's somebody out there also sitting there thinking, look, you're talking about this guy that's 6 foot and he weighs 250, and I'm 6'1" and 175 pounds. Somebody sitting out there thinking, I don't have these heart issues or whatever. Well, this patient I'm getting ready to tell you about woke up with some chest pain at 2 o'clock in the morning. It didn't get better in about an hour, so he went out and got in his truck and drove himself to St. Louis. Walked in the ER. He had a family history of cardiovascular disease, but he wasn't on anything for blood pressure, didn't have high cholesterol, didn't even have a clue that he had anything going on. And he walked in and he looked at the lady and he said, I think I'm having a heart attack and I'm having chest pain. So they took him back. He ended up with a stent that morning in his heart. So thank God for his proactivity to go up there and do that. But you can't just say because I weigh this much or I'm this tall or whatever. You never know. So, yeah, that's all the more reason that at least once a year go in and get a good preventive examination.
Right, and that exercise, and that's why you do it in moderation, especially at first when you get started. If you start to exercise, you get short of breath, stop, get your breath back, and then continue to go. You wonder why people have heart attacks when they go shovel snow. Because they don't work out, they don't do anything, and all of a sudden, a little 1 inch of wet snow is not going to go kill me. Yes, it might. Once you get a shovel of that, or 2 or 3 or 50, that 50th one, when you lift that weight that you're not used to doing, and then try and toss it, and all of a sudden you kind of feel like your chest is on fire. You've probably done too much.
Sure.
And hopefully you don't get a heart attack. But this is the problem we have. That's why you need to work into these things. And that's why you go talk to your physician before you start a good exercise routine, because you need to increase it slowly so that get that heart. You got to retrain the heart. If you haven't been doing anything for 5 or 6 years, that heart muscle is not used to going out there and running a marathon.
It's not coming back overnight.
Nope, that marathon's not going to be run today. I can tell you that. So, but they really do need to check with their physician and then be honest with you. And if they have had some issues, they need to tell you so you can put something together for them that will work for them so they don't get frustrated.
Well, back to what I said in the beginning.
Mm-hmm.
A lot of these guys don't tell the whole truth.
Well,
if they come into the clinic and they don't tell everything that's going on, and I see a lot of couples. So the wife will be in, she'll say, hey, so-and-so's coming in next week. And he probably won't tell you, but, So that's
Have I heard that before?
Oh, yeah, that stoic guy, you need to be straight up with your provider. And I guess the thing I say the most, if you don't feel comfortable with your provider and you don't feel like that's somebody that you can come in there and just talk to openly, then you might want to think about finding a different provider.
That's right.
Because you got to have somebody that you have a click with, a bond with, somebody who really cares about you and got your best interest.
And one thing, Jim, and I know you have seen this too, if your provider tells you something that you don't want to hear and you think, I don't want to deal with that guy anymore, I'm going to go somewhere else, that other provider may tell you exactly the same thing. Maybe you should listen to what your provider is telling you, because he's not trying to scare you. He's trying to tell you, you might need to do this. You probably should be looking at doing this. You're making suggestions to them to change their lifestyle for their health.
Yeah. In any profession, whether it's automobile mechanic, whatever, it's about relationships. And I have the greatest group of patients. I mean, we brought almost everyone from Rolla with us down here, and I tell every one of them, thank you for coming, because I mean, it's not like I'm just across town now. I'm 20 miles away. And it's about relationships, and I challenge everyone out there, if you don't have a provider, go find someone that you form a relationship with, that you trust, and you believe in, and you're comfortable with, and it's like if you wake up tomorrow and you've got a car issue, well, it'd be a whole lot better if that mechanic knows your car and knows you,
Right.
than trying to get something done immediately. And so everyone in this whole listing area needs a provider that they see once a year, if that's all they see them. Hopefully that's the only time you need them, is come in
Right.
once a year, update the chart, maybe draw your 1-year health and wellness labs, and go on about your business. But you need a relationship with a provider, because if you wake up tomorrow morning with chest pain, your chances of calling the clinic and just may not be the greatest of getting in right away with the person you want to see.
Yeah. One of the things, too, and I hope people do this, and I learned this from being an athlete, you basically every year should get a physical. You should go in, if nothing else, get the physical like you're talking about, get that blood work done. It's just a snapshot of what your health is that day, but I guarantee you, if you know that physical is coming up, you're gonna make the effort to try and make sure that you're in good shape going into that physical. You don't want the doctor to come back and say, "Hey, man, how many bags of chips did you have last night?" That's not the idea. But a physical every year, and then maybe the physician may say, "You know what? You haven't had a chest X-ray in 15 years. Might be time we take a little look. If you're having a little issue here, let's just take a look. Be careful." And we always want to be cautious, but I'm going to go one more thing back to what you're saying about trusting your physician. You have to be able to trust your physician. You got to be able to openly talk to that physician like a friend, and just lay it out there. And if you can't remember everything that's happening to you, write it down.
Exactly.
I
ask patients between
bring
visits.
it with you.
Exactly, between visits, especially. I'm internal medicine, so a lot of the people I see are elderly, and I ask them, hey, keep your little notebook, and if you think, hey, I want to ask Jimmie about that when I come in, write it down. I'd rather them have a list, spend more time and cover everything, than them to get home and think, oh, I had 2 issues here, big time, I didn't, cover. I know we're talking about men's health today, but just to plug the women a little bit, this once a year, and I know the ladies don't want to, they hate this, but I always go through when I see a patient, tell me about your surgical history, and then we get to those dreaded questions. When was your last mammogram? Should have one every year. When's your last bone density scan? Should one have one every 2 years? The Pap well woman thing, when we made some changes to insurance a few years ago, without going into the politics, we kind of went from having an annual PAP to sometimes they say up to 5 years. Well, I always encourage them at least every 1 to 2 years to have that PAP well woman. But I know, ladies, that you guys get hit a little harder than the men. Our big thing is the colon and the prostate. But all these are very important. And you was talking about the anyone who smokes, when they're a new patient and they come to me, I try and get a CT of their chest, just to make sure, get a baseline. Hey, I know there's not that nodule in your lung that was there when we started 2 years ago, so this is something new.
Yeah.
It's going to make a difference in where it's at.
And that's it. That's a key ingredient, too, because if you are a new patient with somebody and they do ask you for a chest X-ray or they want to get a CT, it's a good idea, because as you get older, things change. And if they don't have that baseline, it's hard to tell right away if you're having an issue, where they can go in, take a look at that and say, yeah, that wasn't there before. Let's take a look at that. Let's get a better idea.
Can I share with you one of the worst parts of my job?
Yes, absolutely, because you're an honest guy.
These insurance plans. We have patients now who come in, and really all they have is an insurance card. They have a $6,000 deductible per family member, so they don't really have insurance, and it's a shame. We as healthcare providers, I always ask the question, we need to do this or that, but I hate to run up a bill on you. You know, I'm not here to do that. And I know you're sitting there thinking in the back of your mind, I'm looking at the patient, I'm saying this, I know you're thinking money here. And I give them options. We have other options.
Sure.
We have financial assistance at SMDH.
Right.
Phelps Health has financial assistance program. And for those people who have high deductibles, there are some commercial radiology places where you can get MRIs or CT scans, and just pay cash. And they're affordable.
The hospital will do that.
Yeah,
You
hospital
can
will do that.
You can
Yeah,
do it right
exactly.
here.
Exactly. So we work for those guys. I do. And I'm always going to make the best call. Hopefully I've surrounded myself with referral sources, that we send them to the best person, and we try and save them money. But that's the worst part of my job is the financial burden that healthcare has now put on patients.
Not like it used to be.
No, it's not.
And all this Obamacare crud that they put out there that everybody's going to have affordable health care, that was the worst thing it could have done because it did exactly the opposite, which you knew it would. I mean, I knew it would. As soon as they say everybody's going to get it, then you can't do that.
And I said I didn't want to bring up the political thing, but that's when it all started. Every employer was forced to provide insurance, and so therefore they had to give the patient a card and their family members a card, but along with that became a high deductible. The family and the patient had to absorb a lot of that cost, and it's really a shame because
it doesn't do you any good.
I know.
Yeah, it's just it's there. It becomes catastrophic insurance, and that's really all it did. Matter of fact, I can tell you about when we were talking, and I actually went in the hospital with COVID. My deductible was $6,000. My hospital bill, everything, all the scans, the tests, everything, $5,916.
Yeah. Yeah. So guess what?
Total.
You paid it all.
Paid it all.
So if you think about that patient like you that has a $6,000 deductible, outside of a pretty huge disaster, that insurance, you're paying the deductible every month. They're collecting your money.
Yep.
But you're getting absolutely nothing for your insurance because the first $6 is out of your pocket.
Right. There were a few, because I was admitted to the hospital, there was some deductions off some of the tests that were allowed by my insurance, which probably kept me underneath that $6,000. But, okay. But still, I remember when my deductible used to be $500 years ago. You don't see those anymore. Then it just slowly went up. Then 1,000. Okay. Then 2. Then 3. Then 4. Then 5. Then 6. That's ridiculous. It's just ridiculous because it prevents people from coming to a physician because they're afraid they're going to keep racking up bills.
And that's one thing at SMDH I think we're really good at. I will promise you, if you're sitting out there listening, if you'll come see us, if you have a problem, we'll get you financial assistance. We'll get you over to Karen Frizzell. We'll get you the people who can help you. And we're not going to run up a big bill. But the big thing is, whatever you got going on, it's not going to go away.
No. You got to take care of your health.
Exactly.
All the money in the world won't bring you back.
Yeah. Yeah.
When you get beyond that certain stage, you can't come back.
I've had patients say to me, having chest pain, man, we really need to get a stress test on you. And they say, well, what did that cost? I said, well, can you afford to have a heart attack?
That's just it.
So
That's just it. What's the cost of your health, right?
Exactly.
And listen to your doctor. They always they're always got your best interest at heart. Trust me, they do. You may not think that when you're sitting there trying to maybe. I know I've battled with some doctors before, and but I listen to what they have to say. I may not like it, but I listen, and then I'll say, okay, if I do this, what can I expect to see? And they'll tell me, this is what we expect to see. We want to see lower cholesterol. We want to see lower triglycerides. This is what I want to see. Stop eating all that red meat.
Yeah, exactly.
You can still have red meat, but don't just eat red meat. That's what they want you to do. So listen to what they've got to say, because they're not just telling you just to tell you. They're telling you to make your health better.
Yeah. And I'm really excited. I really am. I came to SMDH 10 months ago, and I've just seen huge gains. We have great equipment, radiology.
Oh, gosh, yes.
State of the art.
Yeah.
And we have some exciting, young providers out there that are energetic. So 5 great ladies that I work with out there. Come out there and see one of those guys or see myself and get your health care started and think prevention.
You betcha. Jimmie, thank you for your
Thank
time.
you for having me.
I know you got to get back to work. Somebody's probably waiting on you right
They
now.
might be.
I've never
I
know.
appreciate the time. I
No.
hope someone out there learned something this
Well,
morning.
we always appreciate you, my friend. Take care of yourself. And again, thanks for talking to us. And it's not just about men's health, but about ladies' health too. But happy Father's Day to all the guys out there. But take stock of your health, because you might be celebrating Father's Day this year, but if you don't take stock of your health, it may not be there next year.
Absolutely.
You always want to make sure
We're here for you.
Absolutely. Thank you, Jimmie. Appreciate it. 729-8000 out at the clinic.
Yes.
Okay, give them a call. You guys are there Monday through Friday and Saturdays as well now.
9 to
too.
2.
That's
Saturday,
right.
we all rotate through. So, and even if you're listening in Rolla, I would just about guarantee you that you're going to have a lot less wait, really great care on Saturday. So come see us. We're there every Saturday.
Very good, very good. And Saturdays are just walk-ins, right?
Exactly.
And just walk-ins. So no appointments taken on Saturday, so feel free to come to SMDH and go to Physician's Office Building 3. That is where the clinic is, and they'll be more than happy to take care of you. And, of course, I wanted to ask you before we got off the air,
Sure.
and I haven't heard, and I actually I asked Charity God about this last week when she was here, about sports physicals. Has that started at the clinic yet, the free sports physicals, or is that coming up?
I'm not sure.
Not
I
sure.
haven't really heard on that.
Okay. They usually do it, I know, sometime and when camps get started, and we're already in June, and I know the camps will start really. Some
Sure.
of the camps are now, but more of them will get started in July as we get closer and closer.
I'll check with Chrissy Decker this week, our office manager, have her give you a shout, and we'll let everybody know.
Sounds good, Jimmie. Thank you very much
Okay,
for your
thank
time.
you.
Stick around, Civic